Your child avoids eye contact. They interrupt constantly. They have meltdowns over small changes. They hyperfocus on things they love but can't focus on homework. You've heard the words autism and ADHD thrown around, maybe by teachers, maybe by other parents, maybe just in your own worried thoughts late at night. And here's the confusing part. So many of the behaviors look exactly the same. Poor eye contact? Could be autism. Could be ADHD. Social struggles? Autism. Or ADHD. Meltdowns? Both. Hyperfocus? Both. Resistance to change? Both. So how are you supposed to know the difference? And why does it even matter? It matters because underneath those surface behaviors are very different neurological experiences. A child with autism and a child with ADHD might both avoid eye contact, but for completely different reasons. They might both have meltdowns, but the internal experience causing that meltdown is not the same. And when you understand what's happening inside your child's brain, not just what you're seeing on the outside, you can respond in ways that actually help instead of accidentally making things harder. Today, we're breaking down 10 subtle differences between autism and ADHD that many parents and even some professionals completely miss. You're going to learn how to recognize the difference between discomfort and distraction, between overwhelm and regulation difficulty, between special interests and ADHD hyperfocus. And by the end of this video, you'll have a much clearer lens to understand what your child may be experiencing internally. This isn't about labeling your child. This is about understanding them so you can support them better. Before we dive in, I need to be clear about something. Autism and ADHD are not mutually exclusive. Research shows that between 30 and 50% of autistic children also have ADHD, and many ADHD children show some autistic traits. This is called co-occurrence or comorbidity. So some children will show features of both, and that's completely valid. But understanding the core differences helps you see the full picture of what your child is navigating. Let's start with why these two conditions look so similar on the surface. Both autism spectrum disorder, or ASD, and attention deficit hyperactivity disorder, or ADHD, are neurodevelopmental conditions. That means they're present from birth or early childhood, and they affect how the brain develops and processes information. Both can impact attention, social interaction, emotional regulation, and behavior. But the why behind those struggles is different. Autism is fundamentally about differences in social communication and sensory processing, plus a strong need for predictability. ADHD is fundamentally about executive function, specifically difficulties with attention regulation, impulse control, and activity level. Think of it this way. If you see a child who won't make eye contact, the autistic child might be avoiding it because direct eye contact feels uncomfortable, even painful. But the ADHD child might not be making eye contact because they're distracted by something else in the room. Same behavior, completely different internal experience, and that difference matters when you're trying to help that child. If this is already clearing up confusion for you, if you're starting to see your child through a new lens, do me a favor right now. Subscribe to the Parenting Blueprint. We break down complex topics like this into clear, research-backed information that actually helps you understand and support your child. Now let's get into the 10 differences. Difference 1, eye contact. We just touched on this, but let's go deeper. Autistic children often avoid eye contact because it's uncomfortable or even overwhelming. Studies using brain imaging show that for many autistic individuals, making eye contact activates the amygdala, the brain's threat detection center, more intensely than in neurotypical people. It can feel intrusive, overstimulating, or like it requires so much effort that they can't process what the person is saying at the same time. So they look away to reduce sensory load and actually hear you better. ADHD children, on the other hand, might struggle with eye contact because their attention is pulled elsewhere. They're not uncomfortable with eye contact itself. They're just distracted by movement, sounds, or their own racing thoughts. If you gently redirect them, they can usually make eye contact without distress. But for the autistic child, forcing eye contact can increase anxiety and make communication harder. not easier. Difference 2. Social skills. Both autistic and ADHD children can struggle socially, but for different reasons. Autistic children often have difficulty with social understanding. They might not pick up on social cues like body language, tone of voice, or unspoken rules. They might take things literally, miss sarcasm, or not understand why someone is upset. It's not that they don't care. They genuinely don't read the social information the same way. Research by Simon Baron-Cohen on theory of mind shows that autistic children often have difficulty understanding that other people have different thoughts, feelings, and perspectives than their own. ADHD children, on the other hand, usually understand social cues. They know when someone is upset or bored. The problem is impulse control. They interrupt because they can't wait their turn. They talk over people because the thought is so strong they blurt it out. They might dominate conversations or struggle to listen because their brain is moving faster than the interaction. It's not a lack of social understanding. It's difficulty regulating their impulses in the moment. Difference 3. Communication style. Autistic children often communicate in very literal, concrete ways. If you say, "It's raining cats and dogs," they might look outside confused, expecting to see animals. They might struggle with abstract language, metaphors, or implied meaning. They also might have a very specific, sometimes formal way of speaking. Or they might be minimally verbal and rely more on gestures or alternative communication. ADHD children typically don't have trouble with abstract language. Their communication challenges are more about organization and focus. They might start a story, get distracted, jump to 3 other topics, and never finish the original thought. They might talk very fast, interrupt themselves, or struggle to find the right word because their brain is processing too many things at once. It's not about literal versus abstract. It's about staying on track. Difference 4. Repetitive behaviors. Both groups can show repetitive behaviors, but the function is different. Autistic children often use repetitive movements, called stimming, to self-regulate. Flapping hands, rocking, spinning, or repeating phrases can help them manage sensory input, process emotions, or stay calm. Research shows that stimming serves an important regulatory function for autistic individuals and shouldn't be discouraged unless it's harmful. ADHD children might also fidget, tap, or move constantly, but it's usually to stay alert or focused, not to regulate sensory input. They're seeking stimulation to keep their brain engaged. If they're sitting still, they might zone out, so they fidget to help themselves pay attention. The movement itself isn't soothing the way it is for autistic children. It's activating. Difference 5. Need for routine. Autistic children often have a strong need for predictability and routine. Changes, even small ones, can feel deeply distressing because they disrupt the child's sense of safety and control. This isn't about being stubborn. It's about how the autistic brain processes uncertainty. Research shows that autistic individuals have heightened anxiety around unpredictability, and routines provide structure that reduces that anxiety. ADHD children, on the other hand, often crave novelty. They get bored with repetition. They might resist routines because routines feel monotonous. They want new, exciting, stimulating experiences. So while an autistic child might insist on the same bedtime routine every night and melt down if you skip a step, an ADHD child might resist bedtime altogether because it's boring and they'd rather do something more interesting. Difference 6. Sensory processing. Both autism and ADHD can involve sensory sensitivities, but they show up differently. Autistic children often have heightened or reduced responses to sensory input. Certain sounds, textures, lights, or smells can be genuinely painful or overwhelming. This is called sensory processing disorder, and it's extremely common in autism. Studies show that over 90% of autistic children have some form of sensory processing differences. They might cover their ears in loud environments, refuse certain clothing textures, or have very strong food preferences based on texture. ADHD children can also be sensory seeking or sensory avoiding, but it's usually about filtering, not intensity. Their brains have difficulty filtering out irrelevant sensory information. So, they notice everything. All the sounds, all the movement, all the background noise, and it all competes for their attention. They're not necessarily in pain from it like an autistic child might be. They're just overwhelmed by the volume of input and can't filter what's important. This can make them seem distracted or hyperactive as they try to manage all that sensory information. Difference 7. Focus patterns. This is a big one. Both groups can hyperfocus, but hyperfocus looks different. Autistic children often have what are called special interests. These are deep, intense, long-lasting interests in very specific topics: dinosaurs, trains, astronomy, certain TV shows. They can talk about these topics for hours, remember incredible amounts of detail, and return to these interests consistently over months or years. This isn't just liking something. It's a core part of how they understand and engage with the world. ADHD children can also hyperfocus, but it's inconsistent and interest-based. They might hyperfocus on a video game for hours, completely losing track of time, but then struggle to focus on anything else. The hyperfocus in ADHD is driven by dopamine. If something is stimulating, novel, or rewarding, the ADHD brain can lock in. But if it's boring or routine, focus collapses. So ADHD hyperfocus is more situational and tied to immediate interest, while autistic special interests are deeper, more stable, and often serve a regulatory or identity function. Difference 8. Emotional regulation. Both groups struggle with emotional regulation, but again, the underlying cause is different. Autistic children often experience emotional overwhelm. When there's too much sensory input, too much unpredictability, or too much social demand, their nervous system becomes overloaded. The meltdown isn't about being spoiled or manipulative. It's a neurological shutdown or overflow. Research shows that autistic meltdowns are physiological responses to overwhelm, similar to a panic attack, and they need time and space to recover. ADHD children, on the other hand, often struggle with emotional impulsivity. They feel emotions very intensely and have difficulty pausing before reacting. If they're frustrated, they might lash out immediately. If they're excited, they might become overly hyper. It's not that the emotion is inappropriate, it's that the breaks between feeling and expressing are weak. Studies on ADHD show deficits in the prefrontal cortex, which is responsible for impulse control, and this affects emotional regulation as much as behavioral regulation. Difference 9. Play behavior. Autistic children often engage in very structured, rule-based, or solitary play. They might line up toys, recreate scenes exactly, or prefer playing alone because social play is too unpredictable. Pretend play can be challenging because it requires flexible thinking and understanding of social roles, which can be harder for autistic children. They might also prefer playing with younger or older children rather than same-age peers, because the social expectations are clearer. ADHD children usually enjoy social play and pretend play, but they might struggle with turn-taking, following rules, or staying engaged if the game isn't stimulating enough. They might dominate the play, change the rules impulsively, or lose interest quickly and move on to something else. It's not a lack of imagination or social interest. It's difficulty with sustained attention and impulse control in the context of play. Difference 10. Motivation. Autistic children are often motivated by predictability, mastery, and deep understanding. They want to know how things work, understand systems, and have control over their environment. Rewards or praise might not be motivating if they don't align with the child's internal interests. Research shows that autistic children are less responsive to social rewards like praise and more motivated by intrinsic interest and competence. ADHD children are often motivated by novelty, immediacy, and external rewards. They respond well to immediate feedback, games, competition, and tangible rewards. But they struggle with delayed gratification and long-term goals. If the reward is far away or the task is boring, motivation collapses. This is because ADHD involves differences in the brain's reward system, specifically dopamine regulation, which affects motivation and sustained effort. So, what's the core difference? If we strip everything down to the fundamental distinction, here it is. Autism is about differences in how the brain processes social information and sensory input, combined with a need for predictability. ADHD is about differences in executive function, how the brain regulates attention, impulses, and activity level. Autistic children are trying to make sense of a world that often feels unpredictable, overwhelming, and socially confusing. ADHD children are trying to manage a brain that's constantly pulled in multiple directions, struggling to filter, focus, and control impulses. Now, why does understanding these differences matter practically? Because the support strategies are different. If your autistic child is avoiding eye contact, forcing it will increase their stress and make communication harder. But if your ADHD child isn't making eye contact, a gentle verbal reminder, "Hey, look at me for a second," usually works without causing distress. If your autistic child is melting down, they need sensory reduction, predictability, and time to recover. Talking them through it or offering choices might make it worse. But if your ADHD child is having an emotional outburst, teaching them to pause, name the feeling, and choose a response can be effective, because the issue is impulse control, not sensory overload. If your autistic child has a special interest, supporting and expanding that interest can be incredibly valuable for their learning, confidence, and emotional regulation. But if your ADHD child is hyper-focusing on a screen to the exclusion of everything else, you might need to set limits and help them shift attention, because the hyper-focus is preventing other necessary activities. Different brains, different needs, different strategies. And what if your child shows traits of both? Then you're likely dealing with co-occurring autism and ADHD, which is common and valid. In that case, you'll need strategies that address both the need for predictability and sensory support from the autism side, and the need for structure, movement, and immediate feedback from the ADHD side. It's more complex, yes, but understanding both conditions helps you see the full picture of what your child is navigating. One final critical point. Neither autism nor ADHD is a deficit or a disorder that needs to be fixed. These are differences in how the brain is wired. Yes, they come with challenges, especially in a world designed for neurotypical brains. But they also come with strengths. Autistic children often have incredible attention to detail, deep expertise in their interests, strong pattern recognition, and loyalty. ADHD children often have creativity, energy, spontaneity, and the ability to think outside the box. When we understand and support these children as they are, rather than trying to force them to be neurotypical, they thrive. So, here's what I want you to take away. If you've been confused about whether your child has autism, ADHD, or both, start by looking beneath the surface behaviors. Ask not just what they're doing, but why they might be doing it. Is the eye contact avoidance discomfort or distraction? Is the meltdown overwhelm or impulsivity? Is the repetitive behavior regulation or stimulation? When you understand the why, you can respond with strategies that actually help. And if you suspect your child may have autism, ADHD, or both, seek a comprehensive evaluation from professionals who understand both conditions. Accurate diagnosis matters because it opens doors to support, accommodations, and understanding. But diagnosis isn't the end. It's the beginning of truly seeing and supporting your child as the unique person they are. Before we close, if this video helped you understand your child better, if it cleared up confusion or gave you a new lens to see what they're experiencing, subscribe to the Parenting Blueprint right now. We're here to give you research-backed, clear, compassionate information that helps you support your neurodivergent child with confidence. Share this video with another parent who's been asking these same questions. They need this clarity too. Your child isn't broken. They're not too much or not enough. They're navigating a world with a brain that works differently. And when you understand those differences, when you see the why behind the behavior, you stop fighting against your child and start working with them. That's when everything changes. Not because they become neurotypical, but because they feel understood. And feeling understood is the foundation for everything else: confidence, growth, and the belief that they're exactly who they're supposed to be.